Hi, today I'm just going to have a quick video on healthcare in the Philippines. The first thing I want to say is it's not as cheap as people think, and there's a reason people do think it's cheap, and for that specific reason it can be. For example, if you wanted some minor surgery that is extremely expensive in the US, UK, oh well, UK may be difficult to get for free, and you're funding it yourself, then yes, India, Philippines, and other places can be extremely cheap and just as good a job. Where it gets expensive is when you're an expat. The reason being is that I have seen several people where they've had some major illnesses, where the costs have just spiraled out of control. Part of this problem is getting good life insurance and good health insurance, because obviously a normal couple together. So I strongly advise getting good health insurance for the Philippines, but also making sure you research that other people have had no problems with that insurance policy and company. Because what you can find is that you have to pay out of your pocket first, then get a reimbursement. All well and good, except when you're critically ill, and you're in hospital for months, and you're racking up bills of thousands of pounds a month, if not more. I've seen people lose £50,000 in the matter of two months because of heart attacks. This is something that's often overlooked by expats. They don't think it'll happen to me, but I tell you now, I've seen people sell their homes to fund their healthcare. Also, they often can't fully recover because there's a lot of the extras that you have in the West, such as people that will go over your general health to help you improve, make sure you're doing exercises, whatever is wrong with you, to make sure that you get back to a normal way of life. Philippines, most places I've seen don't do it. I'm sure the expensive hospitals do, but that gets back to the point is it's not cheap. The problem with this is it's something that's severely overlooked, and a simple motorcycle accident could actually see you bankrupting yourself. Why I know this is it's because several people I know, older gentlemen, have had heart attacks, they've had to sell their homes, they've had to do whatever it takes to fund their healthcare, but I also know of other people that have found that the medical system can become a medical drain, almost as if it's doing it on purpose. I won't say it does, because that might be a legal implication, but if somebody is kept on a life support machine, they're technically dead and it drags on for months, and they encourage the expenditure, then this is something that could possibly happen. And for certain things, I've seen it going on long term, until they run out of money. Also, they keep people in the hospital. I had this when my wife was giving birth. What they did is they turned around and didn't. I was supposed to sign out when I left the hospital. I am neither a patient, and I have not signed any documents. But they make me a guarantor of the money. This I find completely unacceptable, because I had no agreement with them. But this is the sort of thing they get up to. So on that front, I would say good insurance. Make sure the insurance policy covers what you need for medical insurance, but also look into the fact, have other people used it, and did they have what they expected? I've seen so many people as well not get the payout expected, or struggling to get the money they're owed for the healthcare that they expected to be covered within the insurance. Always make sure you have the right insurance, but also healthcare is not cheap. Um, in comparison to the West, it is cheap, but I'm talking about nose jobs, or having some surgery, for example, keyhole surgery for putting a band around your stomach to help with weight loss. Those sort of things are cheap. Dental, very cheap. I've had my teeth completely repaired, rebuilt on the front, and these are now capped. That cost me less than £400. They spent a lot of time on them, but the fact is, dentistry is very cheap. But I would say if you have an accident, expect to pay more than you expected, and everything is chargeable right down to paracetamol, and they will stick every item on the bill. Beyond that, there is ways around the system, and I'll discuss that in another video, but healthcare in the Philippines is not cheap. Okay, thank you.